how to summarize? Okay. Number one, your reflection, right? To make sure that your emotional reaction, your feeling, they all should be all designed for the well-being of the client. Not acting out your own anger, your own emotion. Right? Yesterday, somebody asked me about what happens if the client insults you. Okay? It doesn't matter. They can call your name, they can insult you, but your response should always be designed to help the client. For example, yellow is an essential therapist. In one occasion, the client was very mad, very rude to him. Guess how he respond. You know how he respond? He said, I know you are very angry with me. Acknowledging, okay? You are very angry with me. And maybe you have reason to be angry with me. But remember, we have made an agreement that we don't hurt each other. Okay? Just like play therapy, we don't hurt each other. And what you said really hurt my feelings. Now, he's not reacting in anger, right? He's seeing the fact that the insult from saying hurt my feeling, that will make my job more difficult, make me more difficult to be helpful to you. So that will help the client realize, oh, maybe I shouldn't yell at the therapist. So the key, you have to keep everything, keep the therapeutic conversation at the conscious level. It doesn't mean that there's no emotion involved, but the emotion cannot be out of control. The second thing is that the boundary. Okay? If you discover you cannot maintain a boundary, you better discontinue the relationship. Most of the time, if you're able to maintain a boundary and continue to show give professional help, and use the transference as the material to work on, and then the transference can be beneficial for the client to improve. You know, it's not, transference doesn't have to be a bad thing. I mean, it happens all the time, but it has to be managed properly. Right? So you be a professional, you are mature, you maintain a boundary, and not being affected, not play along with the client, put in the trap, and then you can help the person. On the other hand, if you can no longer function, you're being affected emotionally, either emotionally attracted to the client or emotionally repelled by the client. You can't stand her. Right? It's time to have somebody else stepping in. You step out. Okay? So this, I think, maybe after lunch, after multiple choice questions, maybe I'll type it out. I'll type it out at the test here. This is a test at lunch.
Can we collaborate on the test?
Oh yeah. Of course. Yeah, the whole group collaborated. I'll type it out. I'll test it out.
I'm very excited for
Your work here is done.
Gary, Patty, Donna, this ends part 1. I'm going to end the broadcast and I'll send a new link for the second part of the day, and you can sign in like you did before. Thanks.
Yeah.